This conference will now be recorded.
Good afternoon. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decision for United Healthcare Insurance Company's small group second quarter rate filing. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios. That is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review process, are posted there as well. Our agenda for today will be representatives from United describing their request. Then Division staff will lead a discussion about the Division's review and preliminary decision on the filing. Finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. today, December 10th. The Division will make a final decision about this rate filing shortly after the public comment period ends today. United, please begin by introducing yourself and explaining your rate request.
All right, thank you, Ethan. Steve, let me grab the ball from you.
You got it?
Yeah, yes, I think it should be coming up. I think in the meantime, I can introduce myself. My name is Shamsher Plaha. I am the pricing director with United Healthcare Insurance Company, and I'm located in California. And I'm waiting for my presentation to show up, but let's see. All right, can you all see my screen?
Yes.
Okay.
Yes, it's up.
All right. So let's move on to the next page. So the agenda would be that I will be going over with the summary of the rate change request that we proposed for 4121. And then there will be an additional item that we included in our rate filing, and that's mainly the COVID impact. So moving on to the summary elements. So the legal name of the company is United Healthcare Insurance Company. In terms of our proposed rates, what we have proposed is a reduction of 3.1% from our originally approved rates from our 1/1 rate filing. And that 3.1% reduction is uniform across all plans and all geographies. However, if we consider year-over-year change for the last 3 quarters of 2021, the rate change is minus 4.4%. And the minimum rate change is minus 14.7%, and the maximum rate change would be 14.5%. So The quarterly trends that we are requesting after 4/1/2021 is 1.9%, or on an annual basis, it is 7.7%. This filing will affect 7,078 members as of September 2020. Now, these members are all the members that will be renewing in the last 3 quarters of 2021. The total membership that we have in our or on our books as of September 2020 is 11,791. In terms of portfolio changes, we are not proposing any change to the portfolio. The number of plans, they remain at 44 since our last 1/1 approved rate filing. Moving forward, then the factors that are revised with this filing. So there are essentially two factors. The first one is the base rate, and the second one is the quarterly pricing trend, and that is changing from 1.94% to 1.86%, or on an annual basis, it's a change from 8% to 7.7%. The 8% trend, we had it in our 1/1 approved filing. In terms of changes, there were no changes made to the filing once we submitted it, and there were no errors that were identified. So that actually concludes the summary of our rate changes. The next item we have for additional discussion is really the impact of COVID, what we included in our rate filing. So the experience that we used included some abatement. That is, the non-emergent services, they were not carried at their normal level, and that abatement impact was included in the development of our proposed premium rates, and that was adjusting the base claims by a factor of 1.032. And that actually concludes my presentation, and just feel free to ask me any questions.
Thank you, Shamsher. Now, division staff will lead a discussion about the division's review of the filing and preliminary decision.
All right, thank you, Ethan. My name is Michael Sink, Senior Life and Health Actuary for the Division of Financial Regulation and lead reviewer of this filing. I'll give a minute for everybody else with the division to introduce themselves.
Hi, this is Tim Hinkle as the secondary reviewer on the filing.
TK Keene, Acting Administrator with the division.
Tasha Sizemore, Life and Health Program Manager for the division.
JP Jones, Deputy Administrator.
Okay, that sounds like everybody. I'm going to start by asking a question, Shamsher, on your last point with the COVID impact. You have a factor of 1.032, which is adjusting the claims to the proper 2021 level. So is that correct? If you did not include that factor, the calculation would result in a rate that is 3.2% lower than it currently is, or roughly. I understand you're dividing by instead of multiplying, so it's not exactly 3.2. But is that the general idea, is that this increases the rates, but it's still a rate reduction request?
That is very true, Michael. And just because our experience that we used was kind of like not reflecting the true baseline, it was under what we normally would expect because of the abatement, and that is what we included the factor for. And then I guess your conclusion was correct.
Okay, so I just, this is a public hearing. We throw that factor around, even though this is a rate decrease request. You're mentioning at the end of your report that you're increasing the rate 3.2. No, this is a 3.1% decrease. Okay, I'll get into the proper introduction now. Thank you. So my name is Michael Sink, Senior Life and Health Actuary for the division, primary lead reviewer for this filing. The division actuaries look at three main components on any given rate filing to determine the adequacy and the reasonableness of the rates. The three things we look at are the base period data. We make sure that it's appropriate and that what they give us is consistent with other known public reports out there or their financial statements, information that we have elsewhere that we can verify the data coming through the filing is reasonable and presumably correct. We do not audit that data, but we do validate it. We look at the assumptions that go into the filing to make sure that they are reasonable, not excessive, and make sense for what we know in the marketplace. When we have multiple filings, we will compare them with the other filings in the marketplace and determine reasonability of each of those assumptions. In this case, United Healthcare is the only company that has requested a second quarter increase. So what we do is we compare this filing to their previous filing, look at the changes, and make determination on any assumptions that have already changed. And lastly, we check to make sure that the calculations are correct. This is the easiest part of our job. We double check to make sure that they're using actuarial standards of practice, that they put in the numbers correctly and pop out the anticipated result of those numbers. So this is a second quarter filing, which makes it a little different than how we review a first quarter filing. A first quarter filing applies to everybody that's getting a plan for the year, whether they renew first, second, third, or fourth quarter for small group. And so this is a fresh filing. We see all the assumptions for the first time. All of the factors that change usually happen at that time. And that rate filing was posted in May and has already been approved. So the important part of a second quarter filing is that there are already rates available for second quarter to 2021 and through fourth quarter. So what we are looking at is the changes for the existing rates that are already approved for those quarters to what they are requesting now. And as Shamsher has pointed out, this is a decrease from already approved rates. And since the overall rate decrease is higher than the change, that it was already a rate decrease, and this is going to be an even larger rate decrease. There is a range of increases to be expected this year, but this particular filing is a flat change. Both of the adjustments made to this filing are flat across all plans, all members, all ages. So when we talk about a range of plus or minus 15%, a lot of that is baked into already approved factors and rates from the May filing. So if you have any questions on those changes, please refer to that filing. In this filing, a lot of the information has stayed the same. A lot of the factors identical. A lot of the moving pieces are the same as the prior filing. So we're going to focus on the two pieces that change. One is adjusting the trend downwards. They adjusted the trend downwards on a annual basis of 0.3%, which is very mild change. We have heard across the board that people have not been going to the doctor as much as they were anticipated to in 2020. A lot of that due to fears of the coronavirus. A lot of that due to doctors' offices being shut down or hospital beds not being usable for certain procedures. So that has brought things down. So this is an anticipated change. 0.3% is very mild. In the calculation, this number is applied twice. So when we say a 0.3% change in the trend, it is actually a 0.6% aggregate adjustment to the rates. And this is a part of the decrease, and that is the first part. And with our review, we found no issues with that adjustment. The second adjustment is due to updating the experience period. And as Shamsher has pointed out, There have been several adjustments. They put in new experience. They put in a COVID adjustment for 2021 that they anticipate their utilization to come back up 3.2%. That in aggregate, you add up all of the different changes up and down to the base period experience, and that drops the rates an additional 2.5% for a total decrease of 3.1%. The division has not found any significant issues with any of these changes. We find them reasonable. We do obviously, if we do not approve this rate increase, the rates will be higher because there are already rates out there. So we had no issues with the filings calculations, no issues with the assumption changes for the trend, no issue with the data changes for the base period. With that in mind, we have proposed and this hearing is for a recommended approved as filed for this rate filing. And that's all I have.
Thank you, Michael. United, do you have any additional information or comments you'd like to make at this time?
I am very good, and thank you very much, Michael, and thank you everyone for a careful review of the rate filing and approving the rate as proposed.
The division will make a final decision on the filing shortly after the public comment period ends. We will now take any public testimony. If anyone would like to make a comment, please unmute and introduce yourself. All right, hearing no one ready to testify, I'll remind anyone listening that today, December 10th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.
Thank you.
This conference will now